Partnered by Times Influence.
Hello and welcome, this is Sana Zabeen. In this episode, we get up close with a company that is setting a new benchmark in oral healthcare.
Clove Dental is poised to be the preferred dental care provider in India by offering high-quality healthcare with high sanitation standards. Clove Dental seeks to offer a comprehensive set of oral healthcare services by leveraging the best-in-class equipment and utilizing the latest pain management technology to provide affordable healthcare of the highest quality.
Today we are going to spend our day with Amar Singh, a stalwart who has put in honest efforts to introduce a brand new standard for oral healthcare to the Indian consumer.
Clove Dental, under the leadership and guidance of Amar Singh, is committed to changing the landscape of oral healthcare in India.
We are in conversation with Amar Singh, founder and CEO of Clove Dental. Let's find out his interesting story. Amar, you have redefined oral healthcare services in India by providing world-class infrastructure and services and taking care of quality. You started all this with Clove Dental. Why?
I visited Delhi in 2010 and I happened to walk into a dental clinic for some dental work, and I figured, it's world-class, cheaper in India, so might as well do it here. And as I was going through my treatment, I was using the spittoon where you rinse, and when I spit into the spittoon, I realized it was the rim was very dirty and had a fungus on it. And I was very disappointed, and I said, India is a country where our engineers, our doctors, and our dentists are recognized world over, but yet the infrastructure and the quality that we offer to our Indian citizens is not very good. So that's how the idea of dental care started. So I felt the opportunity to bring in world-class infrastructure, to build in world-class management principles into a field that had been neglected was a great opportunity. And that's how I'm here.
All right. Amar, your disappointment has turned out to be a boom for the Indian oral healthcare sector. Moving on, can you share your views on Indian dental health?
Dentistry or dental problems or oral problems are pretty widespread. 90% of Indians have a gum disease or a dental problem. Okay. Only 10% of them actually go see a dentist because the infrastructure is lacking. And because when you're dealing with dentistry, you're dealing with blood, you're dealing with saliva, so the hygiene and quality becomes very important.
Amar, can you tell us more about your clinics? Why have you opted for an ambience like this?
I think, first of all, we are very cost conscious. So if you look around, everything is made out of natural materials and at a very low cost. So that's one thing important. So, the point of that is that to deliver good quality, to deliver good care, one need not be spending money. So if you go to our clinics have a very cafe-like feel, very relaxed environment. If you're going to be in a healthy, hygienic environment, the surrounding has to be clean. You cannot not have a clean environment. Now, why we believe that this environment should be more cafe style or more relaxed is because dentistry, most people are nervous when they're seeing a dentist.
Right.
Because as we all know, toothache, first of all, it's a very personal space. Somebody's going to be invading your personal space, and the dental problems are perceived and often extremely painful. So when you're walking into a dental clinic, you're already going to be nervous. You're already going to be slightly anxious.
Clove Dental is expanding its customer base by offering world-class services to its patients. Let's find out what their patients have to say about the experience at Clove Dental.
It was a very small, I had a pain in my tooth and I came and it was easily detected and everything was very smooth, and I got medicated. It was a small problem. Then again I had a problem, so it was a repeated visit for some time, but every time it was a very the environment is very cozy over here, so the doctor and all make you comfortable.
So moving on, Amar, I would like to bring in this question. You are into oral health services. So how do you, shortlist your, bank of doctors, dentists? What is the process? How do you control quality?
Right, those are very good questions. So as I said, quality in dentistry is one of our unique requirements and one of our unique value propositions. So I'll tell you what our three unique value propositions are. We ensure that our patients get highest quality of care and treatment. We make sure that our clinics are conveniently located, and we do that in an affordable manner. So those are our three USPs, so to speak.
Okay.
But quality is the hardest of them, right? Because you're dealing with human body, you're dealing with a procedure where a dentist is going to use instruments and go into your mouth. It also depends on your state as a patient. You could be allergic to some medications, you could be you may have some other health problems, or you may not be in a right frame of mind as a person. So a lot depends on the patient's current state of health as well as the doctor. So in addition to just talking about quality, one has to understand that you have to first, number one, hire the best. The second thing you have to do is you have to make sure that they are trained and that they have all the training, whether it's patient care training or upskilling their clinical skills. And the third thing is that you make sure that they have the right incentive. Our doctors are salaried so that they are not worrying about getting their food on the table. And their prime objective is to make sure that they are delivering quality care for the patients. We do audits of our clinics. Every month our clinics are audited twice to make sure that we're maintaining the protocols. We also do case reviews where we actually 30 to 40% of all our treatments are reviewed by a panel of senior specialists to make sure that the diagnosis was right, to make sure the treatment was right, and make sure that the billing was correct. So now, apart from that, the best thing we have going for us is that we have India's #1 dentist, who's our chief clinical officer. He is the most decorated dentist in the country. We are fortunate. We're fortunate to have him, and I think he's in the office today. Perhaps we can, see if we can ask some questions from him.
Why don't we, get him into the conversation?
Sure.
And
Well, let's
find
go.
out more about Clove Dental from him.
Absolutely. I mean, he's definitely the one.
From the man himself.
From man himself, and from a clinical perspective, I'm not a dentist, so I really, I'm a business guy. So he is the person who runs all our clinics, and he's our chief clinical officer. So I think he's the most appropriate person for that. So let's see if we can get him.
Let's do that. Joining us in the conversation is Dr. Vimal Arora. Dr. Arora, thank you for joining us.
Thank you so much.
We'll
It's a
begin.
pleasure.
Can you fill us in with your team of doctors? How do you select them? What do you offer? And how do you make sure they are constantly motivated?
We take multiple steps, to ensure that we have the right team. First is that we hire the best. We go to the most reputed colleges, and it's the first time that the Clove has started the hiring from the campuses. So that is one part. The second part is when they join us here, then we take them further. We make them go through our training, which is not only a training in the practice management, but also the soft skills and the behavioral aspects relating to the patients.
Okay.
And to keep them motivated, I think Clove is attracting the best talent today. The only reason for that is that everyone says that we give the best training. And second thing is we have a career path, where when a dentist joins us, he may join us as a resident dentist or as a consultant. So from a consultant, he moves to senior consultant. Then he can become a deputy zonal head with administrative duties. He can become a zonal head with still larger duties. So they know that their career pathing is absolutely well carved out. And that is which keeps them motivated.
So I'll add here a little bit. I think if you think about with over 500 doctors that we have today,
Right.
We have a network of dentists who have done pretty much, maybe you can correct me, Dr. Vimal, if I'm wrong, but from simple treatments to extremely complex treatment. So if any case comes to us, we have the horsepower, I like to use the business word, but we have the dentist power to
Right.
actually come forward with the best team of specialists to solve a problem.
That's what my next question is about, Dr. Arora. Clove Dental is trying to change the landscape of oral healthcare in India. So by providing quality service, and quality plays a major role in this. So what is your take on that? How do you ensure that quality is never compromised?
When a patient comes to me and he sees my 4-step sterilization, which is a trademark with us. Now this is a sterilization on the same pattern what is being practiced in either America or Europe. Now when a patient comes to us, he sees the sterilization, and when he walks to the other dentist, he says, you know, Clove, they are doing this.
Right.
You're not doing this. So this is helping them change this landscape. When a patient comes to us, we take his complete records. We just don't look at his tooth. We look at him as a whole.
You're raising the standards of the
We
Indian
are raising
consumer
that
as
bar
well.
immensely with our various processes.
So, Amar and Dr. Arora, my next question to you is about, you know, a detailed range of services that is offered at Clove Dental, and how are they different from competition?
You know, we have, right, starting from a normal scaling or filling down to the most complex of the surgeries, including trauma management, including management of the oral cancer patients. We have these skill sets and the capabilities available to handle all the patients. Well, I can do smile designing by my select doctors. We do the implantology cases of the most complex problems. When everyone says that it's not possible, they come to us. And we have many cases to share with you where people have said that it's not possible to put an implant. So we have specialists who have got 30-35 years of experience, and they are placing implants in all these difficult cases.
So on this note, Amar and Dr. Arora, we would like to show our viewers what your team of doctors have to say about their association with Clove Dental. Take a look.
I joined Clove about 3 years back. I sold my private practice to Clove and I joined this organization. And it's been a wonderful journey for me working with Clove. Yeah, and it's been an uphill drive for me all the way.
I was a fresh pass out from college when I had just come back to Delhi after my post-graduation, and I could see this as a very good platform to learn more, work more and be more efficient in what I do.
We work here as a team, so the patient can get the best treatment here, because it's not an individual dentist who's treating the patient, it is a teamwork, and so that they can get the best treatment here.
Welcome back. We are in conversation with Amar Singh of Clove Dental at his SDA clinic. But before we move further, we bring you an intense case study from Clove Dental's archive. Take a look.
Mrs. Ved Agnihotri was suffering from severe tooth displacement. She decided to visit Clove Dental in order to get her smile back, and the experience changed her life forever.
पहले मैं बहुत परेशान थी। जब भी किसी पार्टी या फंक्शन में जाती थी, ढूंढती थी कि सॉफ्ट चीज़ें कहाँ पर हैं। सॉफ्ट चीज़ें ही खाती थी, ढूंढती थी कि मेरे को परेशानी ना हो, चबाने में दिक्कत थी। मेरे मसूड़े दांत थे नहीं नीचे वाले, लोअर दांत तो मेरे बहुत ही कम थे, जिससे मेरे कुछ खाने में बहुत दिक्कत होती थी। तो फिर मुझे फाइनली हस्बैंड ने भी कहा कि नहीं, आप इलाज करा लो। हर चीज़ खाने का मन करता है, जो कि मैं नहीं खा पाती थी, बहुत परेशान थी। मतलब मैं अगस्त 2016 में आई थी पहली बार, ट्रीटमेंट के लिए आई थी। इन लोगों ने बहुत अच्छे तरीके से मतलब देखा, बताया, समझाया। एक्सरे के बाद ही इन्होंने मुझे बताया कि आपको नीचे की आपका जो मसूड़े हैं बहुत कमज़ोर हैं, जिससे कि आपका इम्प्लांट काफ़ी सारे इम्प्लांट डलेंगे, जिससे कि आपको होगा, तभी आप सक्सेस हो पाएगा। तो नीचे मेरे 6 इम्प्लांट डले हुए हैं, ऊपर 4। इम्प्लांट मेरा सितंबर में हुआ था, 18 सितंबर में 2016, और एक अपर का और लोअर का हुआ था अक्टूबर में। 1 महीने के डिस्टेंस। अभी 1 महीने हुआ है मेरे ट्रीटमेंट को ख़त्म हुए। मुझे बहुत अच्छा लग रहा है। मैं हर चीज़ खा लेती हूँ और हर चीज़ को एंजॉय करती हूँ। जो चीज़ें मैंने 1 साल से पीछे नहीं खाई थी, वो भी मैं ट्राई कर लिया है। 1 महीना हुआ मुझे अभी, लेकिन मैं सब कुछ ट्राई कर लिया। मुझे अच्छा लग रहा है।
We are at the patient waiting area in the SDA clinic. Amar will continue with our conversation. So every business strives on the value that forms the core foundation of its system. Can you share some of your brand values with us?
For Clove Dental, we have, as a corporate, identified 3 core values. Number 1 is trust. Trust means that we are going to maintain the patient's trust. Trust means that we are going to maintain the quality that the patient, which is required by the patient, expected by the patients. So trust is a very big word for us, and we always strive to not break the trust. So that's the core number 1. Number 2 is respect. Respect comes into not only respecting each other, but respecting the patient's rights, privacy, information, and making sure that we are respecting each other, whether it's our vendor who's supplying our consumables to us, or it is a vendor who's supplying furniture to us, or for that matter, a vendor who supplies these posters to us. Okay. And the third thing is integrity. Integrity is very important. As I mentioned earlier, in healthcare, unfortunately, what I found out when I came back after many years back to India, that the integrity element in healthcare was lacking. So as you look at these 3 core values, whether it's trust, respect, or integrity, what does that really mean for our patients? I guess I can describe it in 3 words, which is what we are all about, which is love your teeth. So our entire focus is to educate our patients, to educate the Indian population that teeth and your oral hygiene are very important. And just like you love your eyes, just like you love your hair, just like you love your legs and arms and your heart and your liver, you ought to love your teeth.
Also off the reel, can you, take us through some of your technology adoptions? What technology have you adopted recently?
Technology comes in 2 aspects. There is the clinical infrastructure, or clinical, whether it's the latest, root canal equipment, endomotors, or it is the lasers or X-ray machinery. So there's a whole lot of new technology that we are continuously bringing into our clinics. For example, we also brought in things like, slow anesthesia systems that actually make your treatments pretty much near pain-free, right? And then there is a technology which is on the patient data, information, and software side. And there we have developed actually in-house one of the most, with AI in it actually, and a latest technology in patient record management and patient relationship management. In fact, we call it PRM internally, which stands for patient relationship management. And it begins from the first time we engage with the patient, so that we in one place have the entire record of the interaction the patient has with Clove.
Amar, correct me if I'm wrong, your company also offers dental services on the go through a mobile van. Tell us more about that.
So corporate social responsibility, as CSR, is an integral part of our company's ethos and company's objectives. So we have multiple mobile clinics that are full-fledged dental clinics on the go, with a dentist, with a dental assistant, and state-of-the-art equipment. And they are going out and organizing camps, whether it's in a school like Happy School in Gurgaon, Mother Teresa School, or it is the underprivileged neighborhoods of Delhi and surrounding cities, because many of them, those patients are a little hesitant to walk into a clinic of this caliber, although our prices are very reasonable, but I think the ambience perhaps is sometimes intimidating. Yeah. So what we try to do that we actually bring a dental clinic to them, and this is something that we realize that dentistry is a neighborhood business. Dentistry is a neighborhood thing. You don't want to drive or go for an hour somewhere to go see a dentist. So it has to be where you live.
In its endeavor to give back to society, the company has a unique offering, the Road Dental Services. The Clove Dental mobile van is fully equipped with all the required amenities for a dental clinic, and patients can walk in for free dental checkups. Giving us a lowdown on the facilities provided by the mobile van, we got in touch with Dr. Vibhuti Garg, young and energetic and a new recruit at Clove Dental. This mobile van was parked in Dwarka Sector 5 market in New Delhi and catered to many patients who walked in for free checkups.
I have been working with the Clove van for 6 months, and we have shifts. We have field shifts and we have clinic shifts. The number of people entering our van basically depends on the area where we are parked and for the duration that we are parked. We love the appreciation we get for this van. It is very well equipped, if you can see. We have a full-fledged dental chair. We have all the diagnostic instruments for an outreach program that we need. It is well equipped with an air conditioner. So people find it quite impressive, and that's the kind of reviews we get. It is very fulfilling to be able to impart dental knowledge and dental care to people, because that is the whole purpose of us becoming doctors. And to be able to impart it to a community that itself cannot access it is a bonus.
I was actually roaming around. I came here for shopping. I stay here in 19th sector. So I saw this mobile van of Clove Dental, and I have been there to their center at Safdarjung. So I came here for regular checkup. See, my last experience was also good, and this was also very good. And I just actually got some offers also for free screening and cleaning also. And there was this Dr. Garg, I guess. So it was all good. Yes, it is a convenient option for urban and rural people to get their dental checkup on regular basis. And I guess Clove is doing a good job.
यहाँ अंदर आई मैं, मार्केट में आई थी शॉपिंग के लिए, तो मैंने गाड़ी खड़ी देखी। मैंने सोचा भाई मैं भी अपना चेकअप करवा लेती हूँ। बहुत अच्छा लगे भैया, यहाँ पे मैं आई हूँ तो जैसे मेरा इलाज हुआ है, देखा है मैंने, वो अच्छा हुआ।
Last but not the least, what is in store for Clove Dental in the future?
Well, our vision is that we want to be the best dental company in every neighborhood across India. So we want to have a dental clinic that patients such as yourself and your extended family across India can trust and go visit a clinic for their dental needs, mostly hopefully preventive before it becomes a big problem. So I hope you and your family and your viewers will give us an opportunity to treat them. We want to have 600 clinics, and who knows, 600 is less than 1%. So I often tell my team 600 is just the start. I think we're looking at 6,000.
Wonderful. Thank you so much, Amar, for taking out time and joining us. And we wish you all the best with your future endeavors.
Well, thank you so much. A pleasure.
Thanks.
Thank you so
Thanks
much for
a
your
lot.
team. Thank you.
Clove Dental is an honest attempt and is just the beginning of modernizing the landscape of oral healthcare in India. So now if you have any dental issue, you know where to go. I am Sana Zabeen signing off for today. See you on the other side, and thanks for watching.
Partnered by Times Influence.